The ECHELON-2, as probably most of the audience knows, is a randomized double-blinded study adding Brentuximab vedotin to a chemotherapy backbone, cyclophosphamide, doxorubicin, and prednisone, compared to standard dose CHOP and placebo Brentuximab. And 2 years ago, we presented the initial results, which showed significant improvement in progression-free and then overall survival, which were the primary and secondary endpoints. And that was with about 3 years of follow-up. So what we're showing at this meeting is really just the 5 year, so longer follow-up. And kind of the bottom line is that for the overall data set, the primary endpoint holds. There's still significant improvement in PFS and OS, just like in the initial data set, that that benefit is most clear in those with anaplastic large cell lymphoma, which of course always have a strong CD30 expression. The other subsets, as before, other subsets of T-cell lymphoma like PTCL NOS or angioimmunoblastic T-cell lymphoma are small size, under not truly balanced. So while they go along with the primary endpoint, it's hard to see clear conclusions in those data sets. And we kind of show that with updated forest plots, both for progression-free and overall survival. I think the other thing that was looked at was treatment with Brentuximab at relapse. And again, a small number of patients, not proscribed per study, but was certainly available for many patients. There are responses to Brentuximab at relapse, both in the BV-CHP arm and the CHOP arm, including when it was given as next therapy in patients coming off Brentuximab vedotin. So I think that the endpoints hold. The data isn't dramatically different with longer follow-up, and there is some support that Brentuximab can be effective even in patients progressing from BV-CHP.